Hello, everyone. My name is Dr. Imaze Marian Davis. Welcome to Marian Footcare podcast. Today, I would like to take you on a little journey. I would like to take you on a journey that reflects pretty much what I do every single day. As you guys already know, I'm a podiatrist here in Miami, Florida. And typically, as a podiatrist, we do a lot of things, but not quite often that a podiatrist takes time to really take you all on a journey to really see what kind of lives we impact, what kind of challenges we face, how we view the healthcare industry, and maybe what the future really is for all healthcare providers and how we take care of our patients and the way we impact them. Every day, I wake up in the morning and I tell myself, what am I going to do today? Who am I going to impact today? Which of the patients are going to teach me something today? Which of the patients am I going to really impact and maybe even change their life? So today, I woke up feeling pretty good. It's summertime. The kids are out of school. I kiss the kids goodbye as they go off to their summer camp. And I get into my car. I spend a little bit of time going through spiritual reflection, listening to the readings for the day. As I get closer to the hospital, I step out of the car. I know that it's pretty much what we call game on at 9 a.m. I know that the lobby is going to be full. I'm excited. At the same token, I just have this mindset that I pray that my hands is going to help to heal wounds today. It's going to make a difference in people's lives today. So let's just go over what happened. In the morning, as the patients are coming in, it kind of starts, let's just say, easier patients. Easier patients could be maybe the patients that are just routine foot care. Routine foot care are patients who come in, they're high risk. Most of the time, they're diabetic or on blood thinners, or patients with poor circulation that can't even lean over to cut their own nails or properly take care of their feet, or patients who have challenging skin and nail conditions, long time with fungal infection or calluses, warts. These are things that people who go see the podiatrist, they understand what I'm talking about, and we call it typically routine foot care. And as the day starts to proceed on from those, what I say, standard routine foot care, we start getting patients, for example, patients who have had surgeries in the hospitals and they're being discharged and now they're following up in the clinic. And these patients come to you pretty much holding their breath, praying that the intervention that has been done in a hospital has yielded some kind of improvement in their health, in their feet. So for example, I had a patient today who went to the hospital with this big, gigantic ulcer. You can see he's not sure, what he stepped on. This patient has a pretty rigorous job jumping in and out of trucks, moving garbage cans around. And the impact of that in and out of the truck really caused an area of blister. A small minor blister turned into the worst type of volcano-type ulcer on the plantar foot. After trying several treatments, we ended up having to have the patient admitted because, again, with antibiotics by mouth, he just wasn't getting better. By him being off his feet in the hospital and rendering surgical intervention, both minimum invasive surgeries as well as wound debridement, we're able to actually salvage it and close the wound. With a series of antibiotics given to the patient and also immobilizing the patient in a posterior splint, the patient came to the office today just pretty much fingers crossed, hoping that his foot was much better. And yes, as we took off the posterior splint, took off all the dressings, the joy that came into my heart, into the patient's mind to know that that surgical wound is dry, there is no drainage, and it looks like the skin has finally come together. I took out all the sutures, took out the staples, cleaned out the dead skin around the area, and was able to give that patient that great news that they have brand new skin and there is no more opening and they can almost return to normal life. But in the meantime, we just have to wait a little bit longer just to ensure that everything stays intact. So that hope comes to that patient. As I gradually leave that patient and I go to another patient's room, I encounter another patient that has told me that she's been suffering for 2 weeks with this blister type wound on the joint of her big toe. That circular wound, she reminds me, Dr. Davis, remember, you did surgery on my other foot where I had Charcot deformity, which is a very rigorous arthritis that diabetics have. With assurance and also knowing about my skills, knowing what I can do for her, I immediately gave her some confidence that we can heal this. We just got to get the wound to heal, and then we're able to also make sure that the ulcer does not return through minimum invasive procedure. The patient seems to be feeling better and understanding that we're with her in this journey. As the day progresses, we see other patients who are dealing with really bad socioeconomic issues and factors that is constantly a hazard to their wound healing. These patients live in certain conditions at home that is just not conducive to their wounds. Their skin has flared up. All the progress that we've made on the wounds had now been regressed. These patients now have infection. Their skin is sloughing, drainage everywhere. And just last week or 2 weeks ago, these wounds were flourishing and doing very well and on their way to complete closure. And now we've gone backwards just due to the fact that it's so hot in the house. Maybe there is no AC. Maybe there's just no financial assistance to ensure that the environment is clean and conducive for their wound to heal. Then we move on to other patients who are homeless. Our homeless patients are sometimes living in a car. This patient, being homeless, was already faced with a toe that was already what we call gangrenous. I had sent this patient to the hospital months and weeks ago to get intervention. They tried 7 times to restore blood flow. And unfortunately for that patient, the blood flow intervention did not work. So this patient pretty much has been on hold with this toe, with the tip of the toe wound that remained dry. And we just prayed that the gangrene does not extend to the remaining of the foot. But unfortunately today, when the patient came in, pretty much that whole tip of the toe ulcer had turned into an area that had harbored bacteria. By the time I used a 15 blade just to clean gently on the tip of the toe to better evaluate what was going on, there goes this volcano eruption of pus pouring out of the tip of the toe. The patient looked at me, I looked at him, and I said, I am so sorry. This is no longer a stable gangrene. We will have to send you back to the hospital. And this patient just told me, why can't you just take the toe off? And I said to him, listen, the problem is I just don't know if it's going to heal after I remove the toe. Now think about this. The tip of the second toe having this really small ulceration, dry scab with signs of gangrenous changes. And this patient has been living like this where we couldn't go any further to do anything more for him because we just knew that if we were to cut that toe off, that the remaining wound would be bigger and that patient's toe will not heal. So instead, we put him on antibiotics, kept the area dry, and just monitor him. Now, let me tell you, the story does not end there. This patient is facing the same crisis many are facing right now. With the cut going on in healthcare, whether it's Medicaid, a lot of patients who are homeless, a lot of patients who cannot get assistance are finding ways of just creating shelter, whether it's in the car or on the street.
Been like out on the streets like for like the past 4 months.
Wow, so you still haven't been able to find housing, huh?
Nope, not for my price range.
Wow.
There's a lot of homeless people out there, and you know, some people want to play, but some people don't, but they don't just pick everybody. So wow. I've been trying, so I'm trying to stay in a certain price range.
Wow, I'm so sorry about that. Mm-hmm. And what happened to this wound right here?
This from the sun, when I be on the bus stop. The sun shining on my leg and they put a blister right there.
My goodness.
So when the blister went away, it just turned the scab on it.
Wow. And what happened to my right foot? I remember, was it last year or 2 years ago? I did a major surgery. 3 years ago.
July 4th,
Right.
2023.
And you've been able to maintain it, so
All the way till my foot got wet.
Wow.
Last month. My shoe got a little moist, and I think that's what the problem was.
And that's from you also being out there in the
Yep.
rough weather,
Mhm.
being homeless. Yeah, because I remember we had such a major surgery. We put
Yep.
those external fixators. You
Yep.
were so good.
Everybody keep talking about, why you got fixated? I said, don't worry about all that.
Yeah, you were so good. You were so compliant, and
Mhm.
and we got everything to heal. And so you had no wounds since,
wounds
3
since-
years ago.
No, nothing.
And how did you prevent yourself from getting a wound on the heel? Yeah,
I learned to control that sugar and check that foot.
good.
And stop putting that pressure on that thing. I take the mirror and look at the bottom of the foot and stuff, but then last week it rained. I think my foot got a little wet and the shoe was a little soaked. You know,
And
they
that's
got
how
a little
you
moist
got it.
back there, yeah.
This patient, even with his circumstances, he was ready. He was ready to take the letter and go back to the hospital. Because at least in the hospital, he might get some food to eat. He might finally get a chance to bathe himself. He might finally get a chance for someone to serve him. And who knows how many nights the hospital is going to keep him before he returns back to his car in this Florida heat. This is what is happening. This is what is happening with healthcare. This is what is happening with patients who have no one to advocate for them. As a podiatrist, I am very, very excited. I love celebrating our patients' wins, especially when we heal that chronic large wound. Today alone, a lot of patients, I can show you the before and after picture. The wounds we sent them in a hospital, and after the debridement with the graft application and the multi-layer compression dressings, how great they have turned out and how great they have healed. Just imagine all that effort that you make, and then that patient becomes homeless, or that patient does not have the true support that they need at home to do well. And then you're back to the same problem all over again. I don't want us to forget about the conditions and the situations that keeps bringing us back to these patients being at risk of losing their limb. Every day, every second, someone is losing a limb. As I'm trying to end my day, I get a text message from a patient I haven't seen in a while. The last time I saw this patient was in a hospital. The patient had no insurance, and the patient was begging for below the knee amputation to be rendered to him by any of the surgeons. The patient was the one asking for the below the knee amputation and did not receive it. Why? Again, a lot of factors. Number one, this patient was already deemed for failure. He has no insurance. And I had tried to get a company to cover prosthetic limb for him after the surgery. And the companies told me that, you know what, prior we used to, but now we got bought by another company. We no longer offer free prosthetic limbs. So this patient decided, what? Dr. Davis, I cannot go through with this surgery because who's going to give me a leg? So I literally came up with this idea that we had to wait until June 1st for his Medicare to become active. Transfer him to a different hospital where maybe a surgeon will be willing to do it. And then only he's going to be able to get the proper adequate follow-up care, physical therapy, and as well as work with the prosthetic to be able to get him a prosthetic limb. This patient had already suffered. The leg was not functional to him. The leg was so swollen, it was so difficult to get it into any shoe. And he kept complaining of the severe pain that comes from it, even though he also had neuropathy. He was done with it. He was done with it. He wanted that limb gone. Even with that, it was not enough. Being out of insurance, having no plans for after the surgery is just as deadly as having the surgery. And he knew it. So today, in the middle of this already tough day of mine, with celebration as well as times when you feel down a bit, I received this message from this patient, and he sends me a picture of his below the knee amputation stump that he finally had the surgery. He was just texting me to say thank you. Just imagine, thank you for assisting me to finally lose my leg. Now, as a Christian, I immediately sent him a text saying that I'm praying for your recovery because I know that he still has a long journey ahead. Where are we going with this? What is the future of healthcare here in America? What is happening with all the crisis, with the cut of Medicaid? Our hospital is getting fuller again. How are we going to make a difference? I hope you guys enjoyed this podcast, and I hope you got a chance to just get an idea, just a glimpse of how my day is in the podiatry world and what we do as podiatrists. I love my field. I will keep working hard each and every day to ensure that we give the best care to our patients, to our community, and to continue to educate podiatrists, residents, students who are willing to work in this field because there's so much work to be done. Take care and have a good day.